Welcome to City Life. I'm Beverly Thompson. As you can see, we're going to be taping episodes virtually for a while because of the COVID-19 crisis. As the city continues to deal with this crisis, the Durham Recovery and Renewal Task Force is advising leaders on how to safely reopen our community. Because the work of the task force is so important as we recover, our upcoming shows will look more in depth at specific recommendations it's making and the resulting actions that are being taken. Today, though, we wanted to just start out by getting the big picture of what the task force is doing and why it's needed. Joining me to talk about that are Mayor Steve Schewel and the task force co-chair, Katie Galbraith. Welcome, and thank you both so much for joining me.
Thank you, Bev.
Thank you.
Katie, let's start with you. What is the Durham Recovery and Renewal Task Force, and what are its goals?
Sure. Thank you for that question. So the task force is made up of 15 members, and it is a combination of public health experts, business leaders, community leaders, our faith community leaders, and a representative as well from the county's Emergency Operations Center. And our focus is really to be an advisory group to Mayor Schewel, as well as Commissioner Chair Wendy Jacobs, as they are really working to make really challenging decisions through these unprecedented times,
Definitely.
determining how we can safely and gradually be able to reopen. In addition to serving in an advisory role, we're helping to implement and really act on some of the tangible recommendations of the task force.
Okay. So, Mayor, tell me, why was this task force so needed? Why did you feel like we needed a group like this to get us through this crisis?
Thank you, Beverly. It's great to see you. And it's great to be here with Katie, who's one of our amazing co-chairs of our task force. Katie, thank you. When we first got started, we were really focused, unfortunately, on having to shut everything down. We had to make a lot of quick decisions about closing down first the DPAC and other theaters and then businesses. And it was one whole very difficult series of decisions. But soon thereafter, we had to start thinking about how do we safely reopen? How do we get going again in a way that's both safe for people and allows people to get back to business and get back to their jobs? And get back to normal as much as possible. And we know that people have really been suffering economically. A lot of the public health decisions we made have hurt people economically. And so in order to think about how to do that, we established this Recovery and Renewal Task Force. And the words were very deliberately chosen. We want to recover, we want to renew, and we want to reemerge. And so that was the impetus behind it, Bev. And so far it's been amazingly successful. We have a wonderful group of people who are doing the work.
Great. Okay. Katie, I know one of the main objectives of the task force is communication. That can be so tough in times like this. What are you trying to reach, or who are you trying to reach in that respect?
Yeah, so communication is challenging in the best of times, and particularly at a time like this. And so we are really trying to reach businesses, we're trying to reach organizations, and we're trying to reach the general public with important messages around safety and around how to safely be able to reopen. As the mayor said, so many people are hurting in our community because of this pandemic and the impact that it's had. And so our focus is really on renewing Durham and being able to really move forward. And to do that, we have to be able to communicate throughout the community.
Okay, thank you. Mayor, are there any outcomes or deliverables that are expected from the task force?
Beverly, we're not expecting a big final report or anything like that. We really don't want that. What we want is for the task force to be acting in real time. Advising in real time, and as Katie said, helping to implement some of the things that we need to do. So I'll give you a couple of examples of that.
Okay.
We've been very challenged to make sure that we have enough PPE, especially face coverings, for our vulnerable population and our businesses. And there's a group of folks in the task force and then others that they have recruited into a roundtable to think about how to do that and to do that now. And so we have now 200,000 face masks that'll be useful for our vulnerable populations that are thinking ahead about businesses as well. Another example that is really important is our Latinx community. We know that now the significant majority of our cases, COVID-19 cases every week, are among our Latinx community. And so the task force has done a great job of thinking about how do we change that? What communication do we need to do with that community, and how do we get it to them in both Spanish language, but also in ways that are culturally competent. And so, testing in that community, helping them to trust when people call them to contact tracing, all those things are things that the task force has really helped us think in real time. And that's the deliverable, is stuff that can happen here and now.
Okay, thank you. So did you take all that into mind when you were making the selections of people to be on the task force?
I'll tell you the truth. The first thing we wanted to do was to get 2 great co-chairs. And we've got them. One of them is here with me today, which is Katie Galbraith. Katie is not only the president of Duke Regional Hospital and, of course, closely connected to everything within Duke Health, which has been such a critical partner during this time. But she's also president of the board of the Durham Chamber of Commerce and has great business connections. We knew that would be important. Plus, she's just a fantastic civic leader. And then Matisha Sims, who is, has been for a number of years, she's vice president of Blue Cross and Blue Shield. But Matisha has also been the head of our external audit committee, our audit services committee, rather, for the city of Durham. And so I've gotten to know her and work with her a lot. And the 2 of them have been, Matisha and Katie have been remarkable. We've been so lucky to have them. And then we wanted Katie's already talked about the kind of sectors we wanted people from. We wanted a group of civic leaders who could come together quickly and move quickly. Usually we go through a process of city council appointment, but we knew we didn't have time for the many weeks that this usually takes. And so Commissioner Jacobs and I made the requests of people to serve. And we have an outstanding group of civic leaders, business leaders, epidemiologists, folks connected to the health system. It's people connected to important community institutions. So it's been a really good group.
Hey, thank you. It sounds like an amazing group of people. So Katie, when you all started meeting on May 15th, I don't know if you had a plan in mind, but can you tell me what's been accomplished since then?
Absolutely. It's interesting, as we looked back over the last sort of 4 weeks at our last task force meeting, there really has been a tremendous amount of work accomplished. And that really is a tribute to the group of leaders that we have sitting around the virtual table, if you will. So in addition to the public at large, the task force has identified more than 20 different Durham business sectors and stakeholder groups that have been impacted by COVID-19 and formed those into roundtables. And so we have roundtable discussions taking place with each sector and group, offering industry insights, really coming up with best practices and best guidelines and protocols for reopening. In addition, we've been really fortunate to be able to partner with Duke Center for Advanced Hindsight, and they're helping us come up with industry-specific guidelines and marrying that with behavioral science to develop a voluntary self-certification tool for these stakeholder groups that we think will really help us to reduce risk and reduce the spread of the virus long-term in the community. The tool is going to be voluntary. It's not required for businesses to reopen, but we do really hope that businesses will participate in this because, again, we're all in this together. It's about keeping everyone in our community safe. The tool is going to have a website, and we've been fortunate to work with McKinney Advertising, who has been working directly with the task force and has done a tremendous job in helping us to develop and build out that website, as well as some other collateral materials that will really help to promote safety. And then the other really critical piece to the work that we've been doing is what the mayor had talked about, which is working specifically on the unique needs of our vulnerable communities, particularly right now, our Latinx community, immigrants, refugees, and looking at how we get face coverings distributed, how we work on education, testing, contact tracing, everything that's needed, wrapping around, again, those unique needs of that community.
Okay, thank you. So obviously you can't meet in person. How are you having those discussions, and who is a part of them?
So we do meet virtually. We meet via Zoom, just like this, and we meet every Friday morning from 8 to 10 a.m. as a task force. Those meetings are open to the public, so to listen to the live meetings, you can go to durhamnc.gov and click on the calendar. And when you see the meeting on the listing of events, you click on that link, and that will link you in to join the meeting. And the recording is also available on the city's YouTube channel. So anyone who wants to view the meetings, we really encourage that. And then if you have public comments, we want to hear from you. So you can do that by emailing rrtf at durhamnc.gov. And all feedback will be shared with the task force.
Okay, sounds good. Mayor, participation at every level is the Durham way. So I can imagine that holding these roundtables was really an important component of the task force for you.
Absolutely, Beverly. And as Katie said, we have more than 20 of them, and some of them are business sectors, restaurants, for example, and or personal care businesses, real estate. And others are, for example, our clergy, our faith community, who's done a wonderful job in both. They've urged folks not to come together personally in worship right now, out of concern for spreading of the virus. But they've also come together with some groups that are some houses of worship that are coming together in person and are working out best practices so that they can stay as safe as possible if they have made that choice. So these roundtables are real important, and we really wanted diversity. The roundtable, the task force itself is very diverse in every way. It's racially diverse, and our roundtables are also very diverse in the people that they represent.
That's always important. So what are the outcomes? What do you expect to come out of these roundtables? Will there be directives, suggestions, or however people can use the information that you share?
Well, I think that the important thing is that these roundtables are made up of the people who are impacted by these decisions. So, for example, let's take the restaurant roundtable. These are folks in the restaurant business, but it's also people who are working with them, people from Discover Durham or Downtown Durham Incorporated. And they're figuring out what is best for their business. How can they best come back? What are safe practices? What will give their customers confidence as they come back? And then they will be working, as Katie said, the Center for Advanced Hindsight and McKinney have established this self-certification and that these folks can use to both internally and externally to give their customers confidence that they are having the best safe practices. So that's just one example of what could come out of a roundtable. Things that are specifically useful to those business sectors or those community sectors.
Okay, thank you, Mayor. So I know at the beginning you said that the task force would have a 100-day period of service, and that puts us into mid-August. What do you hope to see at the end of that time, and is there a chance that it might continue?
Well, we don't know what August will hold, do we, in terms of the virus? We know that our case numbers in Durham are going up now. They're going up all across North Carolina. We are concerned about that. They're especially going up in our Latinx population. And so it's very difficult to tell right now exactly what the future will hold in terms of the virus. But if we need to, if the task force, I know that by that end of that 100 days, the task force is going to have done just amazing things to get us on solid ground, reopening, recovering, renewing, reemerging. And if we need it to continue in some form, or if there needs to be a successor group, we can certainly do that. I would hope that we wouldn't have to meet with the incredible intensity that we're doing it now. I'm sure Katie can tell you that. It's a very intense operation. And hopefully by then the groundwork will be laid, and whichever group succeeds this group could do so with a little less intensity.
Mm-hmm. Okay. So, Katie, I know you mentioned that the task force meetings are public. And again, you gave us the information about how people can listen in, but can you give that to us one more time, just in case people want to listen in or even get involved?
Absolutely. Yeah. So the virtual meetings are held weekly. They're held every Friday from 8 to 10 a.m. And those meetings, you can listen in live. You go to durhamnc.gov, click on the calendar. When you see the meeting on the listing of events, you click on that link and then link to join the meeting.
Okay.
And then the recording is also posted on the website.
Okay. Is there anything else that either of you would like to add?
Yeah, first of all, it is such a privilege to be part of this group. It is an amazing group of leaders, as the mayor said. And I feel really, as I said, privileged to be able to serve alongside them. I do think there are some really critical reminders for our community at this time. We are seeing our numbers go up. This is not the time for us to really completely let down our guard. And there are some very simple things that every one of us can do that will have an impact. They are wearing a face covering. So making sure that anytime we are out in public, we should be wearing a face covering. Anytime we can't socially distance appropriately, we should be wearing a face covering. That is easy to do. And we're working with the county, with the city, to be able to distribute face coverings throughout the community to make sure that those are available and easily accessible. The other thing is washing our hands. It's good old fashioned, wash those hands, 20 seconds, soap and water or hand sanitizer with at least 60% alcohol. That is really important. And then making sure that we're keeping our distance, right? So we talk about wear, wash, and wait, waiting 6 feet apart. Those are really simple things that if everyone would do them, they will help us slow the spread of this virus. Wearing masks is an act of kindness. If I wear a mask, I protect you. If you wear a mask, you protect me. If we both wear masks, we protect each other. And if everyone in Durham is wearing a face covering, we're protecting our community, particularly those most vulnerable in our communities. So that's I think the most important message we can get out right now is to be able to reinforce that with our community.
Katie, thank you. We are very fortunate to have you leading the task force along with Ms.
Letitia.
Yes, thank you. Thank you. And Mayor, great job of choosing the leaders for the task force. Mayor, is there anything else you want to add?
I think Katie wrapped it up beautifully. We've done very well in Durham in many ways through this. We have really done a good job of reducing our unnecessary travel. People have been staying at home, and as much as possible, that's all really important. But we cannot let our guard down, as Katie said. We're seeing our numbers go up. So we have to be doing the things that she said, and I thought she described them beautifully. Other than that, I'm just very grateful to the members of the task force, Katie and Letitia as our chairs, but also all the members of the task force who've just been doing a remarkable job.
All right. Well, thank you both so much for taking time out of your busy schedules to join me. We're so grateful to have leaders like you giving us directions, telling us where to think and where to go, and what we need to do to keep safe, most importantly. Well, that does it for City Life. Don't forget to follow us on social media, watch us on Durham Television Network and on YouTube, and listen to our podcast on iTunes. I'm Beverly Thompson. Thank you so much for joining me to learn more about city life in Durham.